Welcome to Experience Army Medicine Interviews. Our mission is to interview local medical professionals within the Army so they can detail their impact in medicine today.
I'm Eric Ahnfeldt, and my AOC is 61 Juliet, a general surgeon. I have a long family history of surgeons. So my grandfather was stationed at Pearl Harbor. He was a general surgeon. My dad was an orthopedic general surgeon in the Army. And dating back all the way to the Civil War, we had Army surgeons or veterinarians in the military. So my dad paid for my college, and I decided I needed to pay for my own school after that. So I applied for the Army's Health Professions Scholarship Program, and so they paid for my medical school, where I attended Kirksville College of Osteopathic Medicine in Kirksville, Missouri. And then that started the journey. So I was reservist during my medical school and went to a civilian medical school. After medical school, I did my residency at William Beaumont Army Medical Center, did 6 years of general surgery residency, and then after that, I was off to the races in terms of my deployments and service as a general surgeon in the Army. So as the chief of surgery, we have 264 people in our department. We cover ENT, ophthalmology, orthopedics, urology, pain management, general surgery, plastic surgery. So all of those fall under the Department of Surgery. So, and all in all, we have 40 surgeons. And then if you throw in the anesthesiologist and the central sterilization process, so I manage all of those things. So usually it's a budget about $26 million that we manage on a daily basis in terms of all the employees in the department. So my life now as the chief of the department is much different than my life has been over the course of my career, which I've gone from a staff general surgeon, which is just doing your job as a general surgeon, to a deployed general surgeon where you're overseas, whether it was doing hurricane relief or Hurricane Maria disaster relief in Puerto Rico or in Kosovo, doing contingency operations when Putin took the Crimean Peninsula and doing NATO operations there. I've been to CENTCOM 4 different times, twice to Iraq, twice to Afghanistan with conventional and unconventional forces. Doing surgery literally all over the world. It's been really unbelievable. It's been a great opportunity. What does the day-to-day look like for me as chief of Department of Surgery? For me, it's there's a lot of meetings. I still do clinical work. So I still do bariatric surgery. I did a fellowship at Cleveland Clinic in bariatric and robotic surgery. So I still see bariatric surgery patients, and I still do surgery to treat obesity and the rest of general surgery too. So I use the Da Vinci robot for a lot of my operations. So we're still on the cutting edge of what everybody else is doing. And in fact, now I've had the opportunity, as I've been in the military, so this next week I'll be speaking to Oxford about what the military is doing with robotic surgery. And so they invited me because the civilian world is always interested in what is the military doing with these new technologies. And so I get an opportunity to speak at Oxford, which is an opportunity I wouldn't otherwise have if I didn't work within the military. There's 6 different places in the Army that you can train for general surgery. I used to be a residency program director too, so I trained at William Beaumont. They're in the top 10 in terms of residency training programs, and that's civilian or military. I think the training is better in the military, and I think a lot of that's because people are drawn to the military because of the mission, the people that you're serving. And those people are people that put their lives on the line every day to defend our Constitution, our way of life. And when you realize that that's your mission, is to take care of those people, it's a little bit different. And not to mention, especially within surgery, within 6 months of you graduating, there's a high likelihood that you will be in a tent someplace and you'll be the only surgeon. And when you know that is the pressure and you're not going to go to some boutique general surgery clinic where there's 5 other surgeons that you can just pull aside and say, hey, what do I do here? What do I do here? But you're the only person dealing with a gunshot wound through the liver. All of a sudden, it makes your desire to learn how to do that stuff far more retainable. So you remember a lot more facts and figures, and you realize your immediate application of what you're learning because you're going to be the only one, and you're going to have to apply that within 6 months of graduating from your residency. So I think the training in the military is typically, especially for surgery, better than the civilian the civilian counterparts. Having been all over the world, you see a lot of how different people practice surgery. I've done general surgery in the Balkan countries, in Europe, South America, and in the Middle East. And so you realize, that there is varying levels when you talk about standard of care, what the local standard is. And you start to realize that quality of care that we provide here in the military is far superior than what you see across the world. But you also learn that you can skin a cat a lot of different ways. And so that allows you to improvise and approach problems a lot more creatively because you've seen it done a lot more different ways than people who've just practiced in the United States. And so I think that further supports the fact that training in the military and being a military surgeon gives you a broader and a better perspective on how to treat different surgical pathology and challenges. I've thought about this question a lot, and people ask me the question, and it was really actually ironic when I came here to Fort Carson, and the motto is care with honor. And for me, really, it is that piece of honor. It is an honor for me to be able to wear the uniform, and it's an honor for me to be in a position where my predecessors also served through all these different wars, and now it's my turn to take up that cause and be here for the American soldier.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army medicine. Be all you can be Army medicine.